All right, looks like everyone's here now. Thanks for your patience again. So welcome to the Endeavors Coordinated Entry Training for the 18th region. So my name's Lindsay. I am the training coordinator at THN. I think I've interacted with all of you so far. I'm joined by Linda, our systems change manager, and today we're going to discuss how to enroll clients into coordinated entry and how to determine their program eligibility. I do have a couple of housekeeping items. Today's training is going to build off of the things that you learned in the coordinated entry training. So again, we're going to build off of what you learned in that coordinated entry, those litmus videos today. Okay, I am now going to pass things off to Linda.
Thank you, Lindsay. Good afternoon, everyone. My name is Linda Shang, and I am the Systems Change Manager at THN, and I work primarily with supporting regions and agencies with implementing coordinated entry. And today, I just want to go over, before we go in and dive into HMIS, I wanted to cover a couple of things. And so I'm going to stop sharing this PowerPoint. I'm going to share my screen. All right, so the first thing that I want to highlight for y'all is we have an Endeavors 18th region Google Drive folder that is open to the public and made specifically for you all as Endeavor staff. And so I will put this, I will copy this link and put it into the chat after I speak. So I recommend that you bookmark this folder as well as bookmark Client Track in your internet browser so that you can always have access to it for this project. So let's go real quickly into what is in this folder. So as you can see, I've got the Aunt Bertha Screener Action Plan, which we did the training yesterday for, so I've included that in there. It includes details about the policies and procedures related to Aunt Bertha and a little bit more details about that. There's the coordinated entry, so policies and procedures for emergency response. And I'll go into that a little bit next. And then the eligibility matrix, which is a matrix that you will use as an assessor for coordinated entry. I also have a Google Doc here, which will include recordings of the trainings. So I've got the Aunt Bertha from yesterday, and then whenever this training is recorded, it will live in this Google Doc folder as well. And then there are just other things like the HP tool, which we will walk through today, and a couple of MOUs that are more programmatic. So real quick, I'll go through the policies and procedures. So this is literally a written version of what we'll go through today. So it includes some programmatic information about endeavors. And then later on, I'm going to scroll down. There's literally a coordinated entry process step by step for y'all so that you can understand what the process looks like from a written perspective. Today we'll do the kind of the visual perspective, if that makes sense. So everyone has access to this. Right now, Alana and I are actually editing it, so we'll let y'all know when it's complete, but I wanted to let you know that this was in this folder and that after this training, you can open this up and hopefully this will give you a nice refresher of what you learned today. And then the eligibility matrix, I will go into it later today, but just wanted to show you a quick screenshot. All right, and then one last thing before I hand it off to Lindsay. Today, we're doing this specific training because what you have found in the litmus training is a little different from what we are showing you today. And that key difference is that because of the large coverage area of this project, we are expanding coordinated entry to include a homelessness prevention tool. This means that you as an assessor will be screening both people at risk of and experiencing homelessness during coordinated entry. And so today we'll walk through that workflow process in HMIS. And again, it's rewritten in the policies and procedures, and that is particular to endeavors and to this project. So with that, I will hand it back to Lindsay.
Awesome, thank you. Now I'm going to share my screen. And you should be able to see HMIS right now. Okay, great. And Linda shared that Google Drive. Awesome. All right, so let's hop into HMIS and take a look at how we would start this process of determining how to enroll your clients and what programs to enroll them into. So to start, we need to make sure that we're in the right work group. So remember from your coordinated entry litmus videos that you're going to have to switch your work group over to coordinated entry. We're actually going to create, we've created a new work group specifically for the 18th region endeavors assessors. And this is what I was talking about when I said it's not in the live site just yet, but it will be after our sync on Friday. So by Monday, those of you who have finished your coordinated entry task lists, you'll have access to this work group in the live site. So just to reiterate, anytime you need to enter coordinated entry data, whether it's enrolling a client in coordinated entry, exiting a client, or editing any kind of coordinated entry data, you need to be in this coordinated entry endeavors work group. Whereas if you were to need to enter or edit any data for homelessness prevention or rapid rehousing, then you'll have to switch back to that non-shelter work group. And we would click this apply button here to make sure that the system follows through. So another thing you might remember from training is the first thing you should ever do is search for your client to make sure that they're not already in HMIS so that we can avoid making a duplicate client. For the sake of this training, I've gone ahead and created a client just to save us a little bit of time. So let's pretend like I've searched and made sure my client was not already in the system. Or, we could also assume that maybe I found my client here in the system. So to get started, we'll click on this coordinated entry workflow button. And just like in the litmus videos, we're brought to this pre-screening page, which you'll remember is not actually attached to my client, even though I see his information here. This is an anonymous counter. Having that said, it's incredibly important that you select the correct assessing community and entry point. And you'll notice that the assessing community you always want to select is the very last one, 18th region. And then under entry point, obviously we will choose endeavors. So very important, even though this is an anonymous pre-screening counter, we want to make sure that we choose the correct assessing community and entry point every time. Obviously you would ask your client this question as we covered in the litmus videos, so I'm not going to go into detail on this. I'm going to say no for this question and click save. So then we come to this page where we can choose if we want to add a new client or use the current client. This is my client that I want to enroll, so I'm going to use the current client. And we're brought to that basic client information page. Again, we covered this in the training. There is one thing that's really important that specifically the 18th region assessors need to do, and that's this zip code field. But you'll notice it's not required. And also you might not know the zip code of where your client is. Let's say my client is from Lufkin. A really cool feature of HMIS is if you type in Lufkin, it's going to bring up a bunch of zip codes for you. If you're not sure which one specifically, I think it's okay to just pick the top one, and you'll see that it auto-populates when you click on that. So it's really important that we fill this out with our clients because you're going to be covering such a large geography. And then at the bottom here, you'll remember from the training, there's a place for you to enter contact information for other individuals besides your client, so to help you get in touch with them. I'm going to say no for this question. Now I'll click finish. So now we come to the information release and security page. This was covered in training. I'm also not going to go into this. And we're on our family members page. You'll see I have a family member here for my client. I don't need to make a third one, so I'm going to click save and close. And now we come to the program enrollment page. So I did want to point out that if you were to click on this drop-down menu, you'll see there is this diversion option. You haven't trained in diversion, and essentially this option is not one that we want to select. So it's pretty easy to remember, just don't change the project drop-down. It should always be on this coordinated entry project, which is easy enough. So we will select both of our clients because I want to enroll both of them into the project. My project start date looks good. I'm not going to backdate anything for this training, and we'll click Save. So now we come to the Universal Data Assessment page. You'll see that anonymous pre-screening page where we first put in our assessing community and entry point, it's pulled that information to this page. So that's why it's so important that you get that right on the pre-screen page. Just always double check and make sure that this looks right on the Universal Data Assessment as well. I'm going to say that my client does not have a disabling condition. This housing status question is really important. So we really want to take the time to figure out which category your client or household is, because this is going to determine how we complete the rest of the workflow. One really helpful thing is you'll notice if I click on category 1, there's a little blurb that pops up below that kind of explains the details of this. I think y'all have already had some training with TDHCA on how to categorize clients, so I'm not going to spend too much time on this. I'm going to say that my client is category 2, which is at imminent risk of losing housing. The one thing I want to stress to you is there's going to be some questions at the bottom about living situation, which should look familiar to you. And you just want to make sure whatever you choose for that prior living situation question matches up with what you choose for the housing status. So like if I were to choose category 2 at risk of losing housing, it wouldn't make sense for me to choose place not meant for habitation. Backing up a little bit, there's also a COVID-19 question right here. Are you currently experiencing homelessness due to COVID-19? Well, my client's not literally homeless, they're at risk of. So it wouldn't make sense for me to answer this question because it's asking if I am experiencing homelessness. So I'm going to select data not collected for this question if my client is not literally homeless. Okay. I'm going to fill in this living situation question really quickly. I'll say my client is staying with family, and we will move on. So now we come to this page, is the client literally homeless? Hypothetically, we've already determined that with our client when we figured out which category they belong to. If you did still have some questions about how to answer this question, you could read some of this text, which would be helpful. And then if you're really still unsure, you can click on this link, which will bring us to this really informative table. So you can answer a number of questions. Is the client fleeing? If not, are they at risk of homelessness? And this will kind of help you determine which of those 2 buttons on this page is correct for you to select. So for my client, again, we said they're not literally homeless. So this no, assess with HP tool at risk of homelessness would be the correct answer to choose for my client. So now we come to this page called the Coordinated Entry HP Assessment Tool, and it's asking me for a score, which I don't have yet. So I'm actually going to stop sharing and pass things back off to Linda so that she can talk about the HP tool.
Okay. Thanks, Lindsay. Okay, so going back to the Google Drive, I do have the HP tool. So right now, the HP tool is not embedded into HMIS. And this is due to the timing and the capacity of our vendor to design and implement it directly in HMIS. And so as a result, our expectation is that you're completing the HP tool outside of HMIS, either on paper or in an electronic format. And so I have a PDF version here that you can print and then have at your desk or whatnot. I also have an Excel version or Google Sheets version as well. And so I'll walk you through what the HP tool is, and then we can talk a little bit more about how to answer the questions in HMIS. So as you saw in the coordinated entry training, we use the VI-SPDAT, or the Vulnerability Index Service Prioritization Decision Assistance Tool for individuals and families experiencing homelessness. And with the influx of HP or homelessness prevention funding and the people who need to connect to that funding, we've developed an HP tool and are including it inside the coordinated entry workflow. And so the purpose of this tool is to determine who is likely eligible for homelessness prevention assistance, as well as collect further information about the household. Now, key point here that I want to talk about, who completes the tool. For the homelessness prevention tool, only the head of household needs to complete the HP tool. This includes households with children and households with only adults. This is very different from the VI SPDAT. On the VI SPDAT, if a household has children, you will complete a family VI SPDAT. If a household has 2 adults or 3 adults, each individual adult will complete their own VI SPDAT. Again, the HP tool is different in that only the head of household will complete the HP tool. So I'm going to walk through the HP tool real quickly and just talk about how it's designed and how to utilize it. So I'm going to zoom in just a little bit here. Hopefully y'all can see this. Okay, so the HP tool is divided into 2 parts, Part A and Part B. So Part A is an immediate risk and safety assessment, and it asks 3 questions. These 3 questions are, question 1 is about fleeing or attempting to flee domestic violence. Question 2 is about how many days will you lose your housing. And then question 3 is the household income of those seeking assistance. So with these 3 questions, you can actually stop the tool immediately if the household answers accordingly. And there are 3 options here. The first option is if they are fleeing or attempting to flee domestic violence and their household income is at or below 50% AMI. And so let me just show you that here. Let's do more than 22 days. So at this point in time, you can stop the tool in a system. The second option in which the household can answer and you can stop the Part A at Part A is that they will lose their housing within 2 days and the household income is at or below 50% AMI. So an option like this. And then the third option is if they are fleeing or attempting to flee and they're going to lose their housing within 0 to 2 days and their income is below 50% AMI. If any of these 3 options apply to the household, you can stop the tool immediately and don't continue on with Part B. The reason for this is that we want to assist these households and we're kind of prioritizing them first for the homelessness prevention because they're going to lose their housing quickly and they're also fleeing or they're fleeing an unsafe situation. So we want to get those folks connected as soon as possible. You'll see that on the Excel document, there's a lot of formulas that will help you, that will indicate and help you understand whether or not you need to stop Part A. So I'm just going to select some things that tell me to move on to Part B. So let's say that we need to move on to Part B. There are more questions. There's a total of 18 questions on the HP tool. And you will go through every single one of them with the client and answer accordingly. And like I said, there are formulas in here in the Excel version where it will automatically total up the points to you. There is a scoring system associated with that. So now that you complete the tool with the client, at the bottom here, you'll see there's a total points, and that is what you would enter into HMIS. You'll also enter whether or not the HP tool assessment was stopped and the client was immediately assisted. And then the other 2 questions are basically the other 2 questions on the top, which is how many days are you going to lose your housing and the household income. Those are the only questions that we are entering into HMIS. And so for now, I will pass it on to Lindsay. And I also want to stop and see if there's any questions. Feel free to put them in the chat as well.
Okay. Linda, did you want to cover the eligibility matrix too?
Oh, yes. Yes. So so at the end of the prevention tool, you'll want to understand whether or not if they're wanting a referral to any other prevention assistance. And so what we at TGen have done is we've created what's called an eligibility matrix for y'all. So an eligibility matrix is a shared list of resources available in the community. And I've designed your eligibility matrix by county, and I've also included the Endeavors team and also the Endeavors geographic region here for y'all to filter and look at. And at the top, you'll see, let me zoom in just a little bit. Okay, so at the top, you'll see program name, funded components, and some generic eligibility criteria for that resource. Please note that when you're referring out to other resources, we don't expect you to determine eligibility for that resource. Rather, we encourage you to say something like, it seems like you are likely eligible for this resource due to your income level. So we're not asking you to do that determination right here. We're just asking you to say you may be likely for that resource, be likely eligible for that resource. And so I've included some information here to help you out. So on the eligibility matrix, you'll see that there are 3 tabs. So I'm currently on the at risk of homelessness tab. There is a literal homelessness tab, which you will use for clients who are going through the coordinated entry and completing a VI SPDAT. I also have a tab for emergency services. So like Lindsay showed us at the beginning, let's say someone does need to be connected to a family violence center because they want services right away and safety is their #1 issue. I've included that information here so that you can make that phone call and connect them as soon as possible. So I don't have eligibility information here because this is more of like, let's get them to a safe place right now. All right, so let's go back to homelessness prevention. Let's say that after you complete the HP tool with an individual, you find that their income is above 50% AMI, and you know that they're not going to be eligible because of that income limit for the Endeavors ESG CV program. And instead, you want to connect them to the Texas Rent Relief Program. And so you can search the eligibility matrix and find information based on the county, and then provide the client, like at that moment in time, this is the phone number you should contact. If you have email, here's also an email address that you can use to contact the Texas Department of Housing and Community Affairs. So in addition to letting them know about this information, you can also use HMIS to record that referral, and Lindsay will show that in a little bit. And so you can actually record a referral to TDHCA, to other agencies that you find on the eligibility matrix too, especially if they're not likely eligible for the Endeavors ESG program. And so that is the eligibility matrix in a nutshell. If you have any questions, feel free to put them in the chat or let me know after this training.
All right, thanks, Linda. I am going to share my screen again. So now that we've done the HP tool, we've determined our client's score, and we have the answer to these 2 questions. We can fill this in. So let's say my client scored a 50, excuse me, on the HP tool. We did not need to stop the tool immediately. We'll say their income was between 31 and 50%, and we'll say they're going to lose their housing in, let's say, 14 to 21 days. So once we've filled this out, we can move forward and click Save. Excuse me. So now it's time to record a referral in the system. You'll see that most of this is already filled out for us. It already has our enrollment and the provider. Again, this is the provider that is making the referral. Once you consult the eligibility matrix and see what homelessness prevention programs are available in that community, that is how you'll determine who you're going to be making this referral to. So that's who you would fill in this box. A lot of the time, it sounds like you will be making it to Endeavors. This is the training site. So the providers, as some of you have probably already learned while doing the task list, the providers in the training site are a little off. We did want to make, we did want to make the one that, let me try that again. We did make a provider that will look exactly how it should look in the live site for you. So if you were to search Endeavors, you'll see there's probably going to be a few that pop up in the live site, but this is the one that you want to select. It's there's two things you should look for. OFC stands for official. Think of this as like a verified account on social media. So anytime you choose a provider in the live site, look for that OFC at the beginning. And then the other thing you want to look for is ESG CV. Since these are the funds that we're using, you'll want to make sure that the Endeavors provider you're selecting has that ESG CV there. So this is exactly what it'll look like in the live site as well. So once I click on that, it auto-populates and we are good to go. We can click save and move forward. Okay. So now we're on this unmet needs page. So this is where you can record any unmet needs in the community that your client's in. I covered this in the coordinated entry litmus videos, so I'm not going to spend a lot of time on this page either. I'm going to say that my client does not have any unmet needs that need to be recorded. Okay, so now we're back on the universal data assessment. If you've started on the task list, you'll know that that's because now we're looping back around to our other household members' assessment pages. So we're done with the head of household, and now we need to enter some information for Sarah. Again, always just double check that the assessing community and entry point look okay. Okay, and I'm going to say this client does not have a disabling condition. It's incredibly important that you are consistent with this housing status for your household. So, you know, just be really thoughtful about this. Don't accidentally choose a different category for a different member of your household. And then again, because my client is not literally homeless, I'm going to select data not collected for this question. And because my client is a minor, you'll notice she was born in 2019, you'll see that this page is significantly shorter than it is for an adult, where they have all of those living situation questions. So I'll click save. Now, it says I'm done. I wanted to clarify something. If this other client was an adult, it would bring me back to that page where you can choose to go the VI SPDAT route or the HP tool route. As Linda clarified earlier, only the head of household needs to do the HP tool. So the system is going to say, do you need to do the HP tool for this other client? I'm sorry, it's actually going to say, do you want to go the HP tool route even though the HP tool has already been completed? You'll just continue to click on that HP tool button. So once you start the track, and we'll look at this again in a second when we do the VI SPDAT track, but just remember, once you start a track with a client's category and housing status and all that good stuff, just stay consistent the entire time. Okay, I'm going to click finish. So we're done with the workflow. I did want to clarify, if you finish the workflow for your household and you realize, shoot, I put some wrong information in there, I meant to put something else, you can always head to your client's assessments and then click the blue action button, view related assessments. You do this in the task list if you haven't already, so hopefully I'm not moving too fast. And then you'll see you have your assessments here. And just like when you were doing the task list, you can always click on this and change any information that you need to. All right. So I'm going to head back to my client's dashboard. So are we immediately ready to assist our client with homelessness prevention? If so, it's now time for us to exit our client from their coordinated entry enrollment. You'll see that there's not an exit date here. We haven't exited our client from their enrollment yet. So if we're ready, if this client needs to move forward immediately with homelessness prevention, we need to enroll them in homelessness prevention and HMIS, but the first thing we have to do is exit them from coordinated entry. So you'll remember from the videos, to exit them, we'll click on the blue action button, and we'll click that exit diversion / CE workflow. I'm not going to go through this. The workflow is going to be very similar to what you saw in the videos, but you know, like with any workflow you do, just remember you have to answer every single page of the workflow until you see that finish button at the end. So once you finish exiting your client, they have an exit date here. Everything is good to go. The next thing that we would want to do is enroll them in homelessness prevention. So remember, well, let me stop there. I'm not sure, for those of you attending this training today, I'm not sure what your role is going to be in this process. So I'm not sure if you are going to be the ones also enrolling these clients into homelessness prevention or rapid rehousing. If you are, just remember that you would have to come up here and click on your name and switch your work group over to that non-shelter work group. And then that would be the way that you could start the intake for homelessness prevention. I actually am going to do that really quick. I have a lot of work groups. Sorry, y'all. I'm going to switch over really quick. And I just wanted to clarify one thing. So I'm going to click this intake button. I'm enrolling my client in the Endeavors Homelessness Prevention project. So I'm just going to skip past these first few pages really quick so that I can emphasize one little thing. Okay, so now we're on this HUD program enrollment page. I wanted to clarify that if you are going to be the one enrolling your client into homelessness prevention or rapid rehousing, as you probably noticed in the live site, there's a ton of options for you to select. There's a ton of homelessness prevention and rapid rehousing projects. It's really important that you take the time to choose the correct one. So these won't look exactly the same in the live site, but there's going to be a lot of SSVF projects. You will also see a project that looks just like this, ESG-CV, homelessness prevention. This is the correct option to pick if you're using ESG-CV funds to serve your client. And there's also this ESG-CC. That stands for city county. So if you're using your city county funds to serve your client, this would be the correct option for you to choose. So I just wanted to stress, make sure you take the time to pick the right one because this does really matter when it comes time for reporting. There is quarterly reporting for ESG CV, and another thing I wanted to stress is timeliness. So because of this reporting, it's really important that we make sure that this data is in the system when those reports are being pulled. So just entering data in a timely manner. Okay, I'm going to cancel this workflow. I'm going to switch back over to our coordinated entry Endeavors work group. I'll click apply. I think I might see a question. Let me take a look. Oh, okay, just Linda. Okay, great. So we've taken that entire track through the homelessness prevention route. What if our client is literally homeless? I actually created another client and I started a workflow and it's in my paused operations. So we are going to resume the workflow for this client. So I created another client, another household, excuse me, and I started the workflow for them. I enrolled them in coordinated entry, just like we did with our last client. And now I'm on this universal data assessment page. I kind of just skipped ahead to save us a little bit of time. Again, I'm going to make sure my assessing community and entry point look okay. I'm going to say no for disabling condition. Now, for housing status, I'm going to say category 1 homeless. My client is literally homeless. So now I can actually ask them this COVID question, are you experiencing homelessness due to COVID-19? You'll notice if you say yes, there's a couple of options that you can select, and you can select as many as are relevant to your client's situation. Excuse me. Okay. And then we have our living situation. Again, make sure that you're selecting an option that applies to a literally homeless person. Okay. I'm just going to put some information in here and then we can move along. All right, so we're back on this page, and obviously we are going to select yes, assess with VI SPDAT, and you'll see it says literally homeless there. So now we come to this VI SPDAT history page. If you've been working on the task list, then this looks familiar to you. If you're not exactly sure, you know, which household members need a VI SPDAT or which VI SPDAT you should use. All of that is written up here for you. So you don't necessarily have to remember that. Just take the time to read this and make sure that you're doing it correctly. So again, if my household is made up of only adults, which it is, then I would need to do a VI SPDAT for every member of my household. Excuse me. So I'm going to click this, and I covered this in depth in the training, so I'm just going to quickly go through and try and score some points for my client so that we can look at it on the next page. All right. I think that should be good. Let me do one more. So my client has scored a 7 on the VI SPDAT, and you can look right here and see that means that they probably need an assessment for rapid rehousing. So I'm going to click Save. Again, we're not going to share the score from the VI SPDAT with our client. We will only tell them what they're eligible for. So again, we'll see our score here on the right, and I'll click Next. And now we come to the VI SPDAT outcome page. This page is really important, as we talked about in the training. It'll tell us what our client's eligibility results are, so that not enough data, remember that means they didn't necessarily score high enough for permanent supportive housing, but they did pass the eligibility for rapid rehousing. So we'll click on this little, I like to call it the blue buddy icon, and this is going to bring us right to that referral page, and it'll automatically select rapid rehousing as a service, which is pretty convenient. As Linda, let me back up a little bit, sorry. As Linda was talking about earlier with that eligibility matrix, this is the time for you to consult that. So you'll look at your eligibility matrix, you'll look at the community that this client is in, for example, Lufkin or Angelina County, and you'll see what rapid rehousing programs exist in that county. For a lot of these communities, the Endeavors Rapid Rehousing Project might be the only one available. In other communities, there are others. And just remember, based on eligibility and client choice, you're going to make as many referrals as you can to as many rapid rehousing projects as there are in that community. Okay, and then again, for this example, I'm just going to choose the Endeavors one, and we'll look for that OFC and that ESGCV, and that tells us this is the official Endeavors ESGCV provider. Okay, while we're here, you don't want to fill out this date acknowledged necessarily as you're making the referral, but just remember that this is the page you'll come back to acknowledge this referral, if that's what your role in this process is. If you're on the receiving end of this and you're going to be putting this person into rapid rehousing, this is where you would come to acknowledge that referral. And the last thing I want to emphasize is this email authorized button. So as part of that warm handoff process where we want to inform the agency that's receiving this referral, hey, I am referring my client to your agency. Even if it's your own agency, I always think it's a good idea to check this box, and it's going to send them an email and just let them know that they have a referral waiting for them. So when we click save, an email box is going to pop up. I'm not actually going to send this, but in the live site, the email address up here, it would basically send someone at Endeavors an email letting them know, hey, we're informing you there's a referral coming in. So I'm not going to send this right now, but it's a really good idea that you do that in the live site. Okay, so once I've done this, I've continued clicking this blue buddy icon, and I've made as many referrals as I need to for my client. I'll click next. And then, okay, we come to, there we go. So then we come to the quick referrals page. This is another page where you could make referrals for your client. There's a few things missing here. For example, it doesn't automatically select the program that your client is eligible for. So I would have to go down and find rapid rehousing. I would still choose my provider name like we did on the previous page. You'll notice that email authorized button isn't here either. I personally prefer making all my referrals on the previous page, but you could also make them here. The pro of the quick referrals page is that you can make multiple referrals at once pretty quickly. Okay, so I'm not going to make any referrals here. I'm going to click Save and Close. And then we come to our Unmet Needs page. Again, I'm not going to cover this. I'll click Save and Close. So now we've looped around to my second client, who this time is an adult. So you'll see that there are some living situation questions here at the bottom. So we'll quickly get through this page since we just covered this. Oops. And again, just stressing that we need to be consistent within our households with category and housing status and all of that. So this is what I was talking about before. No matter whether or not, let me back up. If we were doing the HP tool like we did with our last client, you'll see that it says no, household already assessed with HP tool. So if I have 2 adults in a household, I only need to do that HP tool for the head of household, but I would still want to click on the HP tool button for the other member of that household just to move forward with that HP track, sort of like choose your own adventure. But again, we're doing the VI SPDAT track right now. We're going to stay consistent with our head of household, and I'll click this VI SPDAT button since they're literally homeless. Okay, and then I do need to do a VI SPDAT for my other client because she is an adult, as it explains up here. Each adult will need a VI SPDAT. However, for the sake of time for this training, I am not going to complete a VI SPDAT. Do as I say, not as I do. Okay, and then you'll see because I didn't do it, it says not enough data, but this is where I would also make referrals for my other client. I'm going to click next, and then we're done. So we're totally done with the workflow. We have 2 members enrolled in coordinated entry. Just like last, oh, sorry, let me back up. Started to jump the gun a little. So there's one last thing that we need to do. There's actually 2 last things we need to do before we can move on. And a lot of you, if you've done the task list, then hopefully you know what I'm talking about. We have to make those CE statuses. We have to update our client's CE status. So we're going to go to the services page because that's where we make CE statuses. Click Add New Service. And my date looks good. I have my enrollment here. And then again, under services, I'll scroll down and find the CE statuses section. So I'm going to make a client assessed CE status. Okay, and then there's one other thing that we have to do, and it's really easy because it's on this same page. We're basically going to make another service, choose the same enrollment, but this time on the services dropdown, we're going to look at this active/inactive statuses section. So the only ones of these that you need to worry about right now is whether or not your client is sheltered. So we would choose active sheltered or active unsheltered, depending on your client's situation. My client is not sheltered, so I would choose active unsheltered. And then I would click Save. And if you're wondering why we just had to do that, I'm actually going to stop sharing my screen and pass things off to Linda, who's going to explain the why of those active and active.
Lindsay, so I don't have a visual for this, so I'm just going to talk out loud about these statuses. So both the CE status and the active and inactive statuses are used to communicate and describe a household situation. And so like Lindsay showed us, they are recorded using that services menu in HMIS. And so with the CE status showcases where the client is at in terms of gaining permanent housing. And active and inactive statuses communicate whether the household is engaging in the housing crisis response system. And this follows the active households policy in the Texas Balance of State Continuum of Care. This policy states that if a client has completed a coordinated entry enrollment, has had no contact with any entry points, system navigators, or community outreach in a region for 90 days, and has had no services or shelter stays in HMIS for the past 90 days, then the household is considered inactive on the housing priority list. This policy is really helpful for us because it helps us understand who is engaging in the system at the moment. We know that people come in to the system and they may leave, or they may, their situation may be resolved, or they just don't come back for services ever again. And so we want to keep on top of that. I will say that for the purposes of this project, Endeavors will be responsible for only a few coordinated entry statuses and a few active and inactive statuses. So for coordinated entry statuses, these will include client assessed, client housed, client ineligible, unable to contact client, and client declined. I also know that I'm talking about a lot of things that are also outlined in the coordinated entry policies and procedures. I'm just talking about them here. If you want further information, I would definitely point you into the direction of that policies and procedures to look at the details. And then as far as active and inactive statuses, Endeavor staff will be using 3 statuses. So the 2 that you just saw Lindsay use, active unsheltered, active sheltered, and then the last one is inactive permanent housing. This is for folks who are enrolling into a rapid rehousing program, and therefore we need to mark them as inactive so that we can focus on those who are active on the housing priority list. Like I said, keeping up with these 2 statuses are helpful because they help us at THN filter the housing priority list and stay focused on those who are actively in the system. And in addition, I will be the staff member who will be marking these folks inactive after 90 days, utilizing information from HMIS, and then marking those who return to active because, a client can go from active to inactive multiple times throughout their journey, and we want to keep a track of that so that we know who we're engaging with at what time. So what is the purpose of these statuses in general too, right? Like I said, they show up and are useful in terms of filtering the housing priority list. And so I'll talk a little bit about prioritization and what that looks like. A lot of the prioritization process will be done at THN. I just want to alert y'all so that you know that after you do this referral and you record a referral, those referrals still need to be prioritized for rapid rehousing. So what is prioritization? Prioritization is the process of arranging households seeking assistance through coordinated entry based on their level of vulnerability or need. And the household's level of vulnerability or need is determined by analyzing the information that we got from the coordinated entry assessment against these prioritization standards. And these prioritization standards are set by the balance of state continuum of care. What's special about the COVID-19 pandemic is that we have time-limited prioritization standards. You can actually find them on our website, and they are also included in the coordinated entry policies and procedures. So these factors include whether the client or the household has anyone with a chronic health issue. A second factor is any household member age 55 or older. Third factor is whether the client or household includes a survivor. The fourth factor is sleeping in an unsheltered location. And then the fifth is the earliest enrollment date in HMIS. Again, this information is included in the policies and procedures, and these factors are what we use to sort the list so that the most vulnerable person, so let's say the person who does have a chronic health issue and is age 60 and they are staying in an unsheltered location, we're prioritizing that person above others, right? So how do we prioritize? We are going to download the housing priority list from HMIS. By we, I mean THN staff. We will download the housing priority list from HMIS, and we will prioritize those using Excel, and then we will email a list back out to Endeavors in order of priority. Endeavors will then go through the list and contact the household. All of this is explained on page 6 of the CE policies and procedures for emergency response, specifically under the heading called Rapid Rehousing Follow-up. And so I wanted to talk a little bit about the housing priority list because it's a step that THN is going to take to help y'all with prioritizing these rapid rehousing referrals, and those statuses will help us in keeping that list up to date, so that we are not including those who have already been assisted, right? So that we're focusing on those who still need assistance, and so that is why statuses are important, and keeping the priority list is important for the purposes of rapid rehousing. And that's all I have in terms of the housing priority list. So I will turn it back to Lindsay to kind of wrap things up. We're almost towards the end. And
Yes.
again, if you have any questions, please put them in the chat.
Yes, definitely. We're getting close. I know this is a lot of information. Again, just want to remind that Linda made that really great document that is going to walk you through every step of this process. So if you're feeling a little overwhelmed right now, that's okay. But yes, we're almost done. So one thing I wanted to cover really quickly is, again, I'm not sure what your specific role within this process is going to be after the coordinated entry process, but I did want to show you how you could find referrals that were made to your organization. So right now we're in the client's workspace. I see the word clients in the top left corner. I'm on my client's dashboard. I'm going to click the workspace button, and I'm going to transition over to the provider's workspace. So I'm automatically on your agency's provider profile. Again, we're in the training site, so this might look a little off, but you might need to search for your provider if you're not already on this page. And you could do that by clicking this Find Provider icon. And this search field is a little more generous than the client search field. So you could just type in Endeavors and it'll bring up any provider that has the word Endeavors in it. And you'll see we have our OFC official provider here. So I'll click on that. And then I'm going to minimize this. You should have two separate little dashboards here. Excuse me. So you'll see down here we have a 4.20 dashboard. So these were clients that were referred to prevention assistance. And then you'll see up here we have just basic referrals, and a lot of these are going to be your rapid rehousing referrals. So if you wanted to come to a place and just be able to see all of the referrals that were made to your organization, this is where you could do it. If someone forgot to check that email authorized button when they made this referral, so they forgot to let you know that they referred a client to your agency, you can always just come here and check, just kind of like checking your email, just check it sporadically and see if any referrals have come in. There's also two really helpful little buttons here. So this is the rapid rehousing referral that we just made for our second household. This button on the left will actually take us right to that client's dashboard. So if I wanted to go and make a rapid rehousing enrollment for my client, I could just head to their dashboard and go from there. However, the first step of receiving a referral is acknowledging it, right? You're supposed to acknowledge that referral within 3 days. So if I click this little pencil and paper icon, that's actually going to take me to edit the referral. And you'll see that there's that date acknowledged field right here. So I could fill in that acknowledgement date field if I'd like to. Okay. Any questions? All right. I'm going to head back to the client's workspace. We're on my second household's dashboard. So let's say it's time to assist the client with rapid rehousing. Again, just like with the homelessness prevention track, we're going to have to exit this coordinated entry enrollment. And we would do that the same way, blue action button, exit diversion/CE workflow. So we would complete this exit workflow, fill in every page. We would see that exit date here. We've exited our client from their coordinated entry enrollment. And there's actually a couple of other things that we need to do. You should remember from the Litmus course that there's that 4.20 CE event that we would need to create because there's now, let's say there's an opening for rapid rehousing at Endeavors. So we would go to the coordinated entry events page here, add new, and then from event type, we would choose this referral to rapid rehousing project resource opening. There's an opening in our rapid rehousing project, so we need to make a referral to that. You can choose your enrollment here. And then if you remember from that video, this dropdown is asking us to choose the program that that has the opening, essentially. So unfortunately, we're going to see every rapid rehousing project in HMIS. You're going to choose the one that you're referring your client to, or the one that has the opening, which for us is going to be, let me see if I can find it. Here we go. ESGCV. And then we've got rapid rehousing endeavors. So it might be a little difficult to find that, but just make sure you find the correct project that you're referring your client to. All right, and then refer to provider. Again, this would be where you would put the provider that you're referring them to, which would be Endeavors, our OFC Endeavors ESGCV provider. There's some more information you could put here if you have the answer to those questions, like the referral result. If the client was accepted to the program, the rapid rehousing program, then that's great. You can put that. You could put the result date here if you have that. And you could also, if you've already enrolled your client into rapid rehousing, you could select that rapid rehousing enrollment here. We haven't made one yet, so it hasn't popped up, but you can always come back and fill in this information later if you don't have some of these answers just yet. So I'll click Save. I've made my 4.20 CE event referral. And just like when we entered our client into coordinated entry, now that we've hypothetically exited our client from coordinated entry, we're going to have to go back to that services page. Remember, we made our client assessed CE status and we made our active unsheltered status. We've got to update those because our client has now been exited. So add new service. We'll choose our coordinated entry enrollment. And then this time I'm going to choose, for my CE status, I'm going to say client housed. This was a successful enrollment for my client. And I'll click Save. So I've updated my client's CE status. Now I need to update the active, inactive status. So again, add new, choose that enrollment. And this is that other status that Linda was talking about. She was saying really the main three that you're going to need to interact with are active sheltered, active unsheltered, or inactive permanent housing. So since my client is now moving on to rapid rehousing, they're going to be inactive and we'll put permanent housing. And I'll click Save. Okay. And then I'm going to head back to my client's dashboard, and I just wanted to clarify again, if your role in this process is to also enroll your client into rapid rehousing, if you're going to be following along with this client the entire way, you would just want to switch your work group over to that non-shelter work group so that you could create a rapid rehousing enrollment for your client. And then again, just stressing that you make sure to take the time to enroll them in the correct project, like we talked about earlier with homelessness prevention. I think that's everything that I have. Linda, I'm not sure if there's anything that I missed that you wanted to clarify, but I know we're a little early. If anyone has any questions, this is a great time for us to cover that. And I just want to keep stressing that we are recording this training. You will have access to this video if you didn't retain any of this. And also that document that Linda created is a step-by-step. It's going to kind of hold your hand as you go through this process the first few times. And like with anything, after you've done it a number of times, it's going to feel a lot smoother.
Lindsay, I just wanted to state just one thing, just
Yeah.
reiterating what Lindsay was saying about the enrollment. So our hope is that there's a coordinated entry enrollment, and then subsequently, if that person does move forward, then they have that rapid rehousing or the homelessness prevention enrollment over afterwards. So that the end date of coordinated entry aligns closely with the start date of the homelessness prevention. And one of the reasons why we created this specific workflows is that we don't know who may be calling you, right? And they may or may not qualify for ESG, and we wanted you to be able to record that information and help them out too, right? If they are not eligible for that ESG CV program, what other programs could they be connected to? And so that's one of the key reasons why we developed this workflow and work group for endeavors in particular. Yeah, I just wanted to reiterate that. And I did update the link. I realized that I had put in the link for MOU instead of the actual drive itself. And so it should be the second to bottom link. And then I also created a direct link to the CE policies and procedures. But with that, please feel free to ask us any questions on what you have seen today. Feel free to put that in the chat.
Thanks so much, and have a great day.